Hi, my name is Anita Varelas, and I'd love to tell you a little bit about me so you can know my history and then how I help people. But I have been in the senior living industry in the Bay Area for 22 years, so quite a while. And I actually started as a waitress in the dining room in an assisted living in the East Bay. The same assisted living that I helped my grandmother move into, which is pretty cool. I then was promoted to sales director in the senior living community. And throughout my 22 years, I've worked in a lot of different senior living communities around the Bay Area. I held a regional role for California, Oklahoma, and Texas to help the sales directors and the admissions department with their process with showing the community to seniors. And I've also helped 4 of my grandparents move into senior living communities. About 2 years ago, I wanted to utilize my knowledge and my expertise and my vast network of professionals to help seniors that are in this situation go through this process. So I started my company, Neighborly Senior Placement, to help seniors and their families to navigate all of these variables. May I ask, has anyone in the room looked into senior living for themselves or for a family member? Has anyone gone through that process? Wow, okay. What I find is a lot of people doing this on their own. They are doing it most of the time in a crisis situation where they see something has happened or changed with their loved one. The Alzheimer's Association showed some signs of dementia, and that's usually something that triggers a family member to start looking for senior living options. And when someone starts looking for senior living options, what do? Nowadays, everything's online. So you usually do a Google search, senior living in Millbrae. And all of these things pop up. You get advertisements popped up, maybe a couple communities. Now there's all these new terms that no one's prepared for. Assisted living, independent, what is a skilled nursing, what is a nursing home, what is this thing called a boarding care? And you are making calls, you're trying to get a hold of somebody, the sales directors aren't available, you don't know the difference between an assisted living and a skilled nursing. Who's gonna pay for these options? Does Medi-Cal pay for the options? Medicare, long-term care insurance, all of these variables. Is this a good community? I have no idea. We hear the horror stories about these communities. How do we know we're putting our loved one in a good place? How do we know what our loved one needs? How much can they afford? What does senior living cost? All of these variables, which is why I started my company. Over 22 years, I've been to, I'd say, about 90% of the communities in the Bay Area. I know the sales directors, I know the executive directors. They are friends of mine, close colleagues. I have access to a network of knowledge that I want to utilize to help people. So I started my company. There are multiple people on my team, and we help people throughout California. I'm local. I'm in San Bruno. We're neighbors. And I want to talk a little bit about the different types of senior living communities and what they cost. And I have a handout for you. And so there are 2 sides. Senior living options is the one that I'll start with, okay? So independent living. These are communities that may look like a hotel, may look like an apartment community. And they are for people 55 plus. Some have different amenities, some have a dining room, some don't. But these are private pay options, the majority of them. I'll talk about more affordable, low income housing later. But they offer services and a lifestyle to attract those who are a little bit more independent. Maybe you're still working, you're still driving, but you don't want to take care of your house. You're tired of doing the lawn, keeping up those type of things, and you want to be among your peers. So this is a community that is unlicensed to provide care. So they basically provide you an apartment and a lifestyle to live. There are a range of these options that are basic apartment living to large campuses for independent living where they have tennis courts and they have pools and all of these various things. There are independent living communities that are a month-to-month contract, which is really nice. You just pay the monthly fee, and then you could move out if you wanted to, go back home. And then there are the larger ones, the more luxury style, that have these large buy-ins from a couple $100,000 to a couple million. And there are a lot of different options with that. They definitely attract those who want the lifestyle, want social engagement. So those are independent living communities. People move in when they are still able to participate in a lot of things. The second option is assisted living. And assisted living is what the majority of my clients move into. I love that we're doing this presentation because I think that a lot of people need the resources to better plan. A lot of people, majority of clients that come to me are in situations where they've waited a little bit too long and their loved one needs some care. And so a lot of people want to have care in their home. I understand that, absolutely. You've spent a long time in your home, you have memories there, your belongings, that's where you're comfortable. And my goal as a senior placement specialist is not necessarily to get you to move out, to move into your community. I am really big on education, and I want you guys to have all the information to make the best decision for you and your loved one, whether that means looking at communities or getting you safely set up in your home. I like to review all of the options so that you guys can make your best decision. So home care is an option, and if that's something that you wanted to pursue, absolutely, let's talk about it. Let's talk about the situation. Home care in this area ranges from $45 an hour to $55 an hour. So depending on how much care your loved one needs, if it's a couple hours, there's a 4-hour minimum. If someone needs a significant amount of care, maybe 10 to 15 hours a day, certainly if you need 24 hours a day, that's getting close to $30,000 an hour, not an hour, $30,000 a month, which is pretty significant. So although a lot of people want to stay in their home, sometimes it's not an option financially to pay $20,000 to $30,000 a month, or their care exceeds the type of care a caregiver in the home can provide, and they need a little bit more support. Or if you're an adult child and you're caring for your loved one, that's a really hard role to play. And sometimes it's helpful to have a community care for your loved one. That way you can maintain the parent-child relationship. And so we look at communities. Communities in the Bay Area range anywhere from $5,000 a month for a shared room, over $20,000 a month. That's a major gap, major gap. I will say for Mid-Peninsula, most of my clients are moving into communities paying about $8,000 to $9,000. So there are a lot of options within that range, but they certainly can go more. I'd say probably a good range is about $8,000 a month to $12,000 a month, and it certainly depends on the type of care and the amount of care a person needs. Assisted living communities are licensed by the state of California. I hold that license to own and operate an assisted living community, which is extremely helpful for me to advocate for my clients and to know what a senior living community can accommodate and what they cannot accommodate. They all are licensed to provide the same basic amenities and services. Have caregivers 24 hours a day, 7 days a week. They're not CNAs. They're trained caregivers. Some of them have medication technicians. Although not a requirement, some of them have nurses, which is a great added benefit. Not necessary for a majority of people to utilize a nurse in assisted living, but if you're diabetic, if you have some type of oxygen treatment, if you have skin breakdown, I would probably recommend you be in a community that has a nurse, because if you have an issue with your oxygen, I'd want a nurse to check that out. If I have something go on with me, that I have a medical condition, I'd rather a nurse look at me. Everyone's trained in the procedures of how to care for a senior, but if you do have a medical condition, that would be something that maybe we look at, communities that do have a nurse. They have activity programs, so assisted livings are very social, which is fantastic because they have an activity director that has outings. You can go to the opera, you can go out to lunch, they can take you shopping. So you can have a social environment, which is really nice. The memory care. Memory care is a term that refers to either a portion of a building in assisted living that is dedicated and locked as a wing, often, for people who have dementia. Now, a lot of communities differ on this, and this is important. If you have a loved one that has dementia, each community is so uniquely different with their comfort level, with their training, with their policy on how they care for dementia. And there's a lot of different types of dementias that affect the brain and your behaviors differently. So you want to find a community that has the experience with what your loved one's dementia is. They are secured units, and often they have a higher staffing ratio because people with dementia need a lot more guidance throughout their day, and they need a lot more hand-holding. There are some people who have dementia, and it's the very early stages, my grandmother included. My grandmother's in assisted living. She can still do a lot for herself, but I do notice it. But she's appropriate to be in assisted living. And each community is going to be a little bit different. Some communities will say, oh, dementia, you have to be in the locked community. And it's not often black or white. Each person is an individual, and we want to assess that individual to make sure that they are in the appropriate and the safe environment. My grandmother has dementia. She's very social. She still dyes her hair red, does turquoise eyeliner. She's loving life. It would be not appropriate for my grandmother at this time to be in a smaller setting with people who are maybe a little bit more progressed. So we want to think about my grandmother's mental health as well, and make sure she gets the appropriate care, both physically and mentally. So memory care communities are fantastic. They specialize in dementia. All of their caregivers have a lot of experience to do a lot of hand-holding, the gentle touch. There's a lot of techniques that we train caregivers on of how to interact and how to redirect and how to respond. We meet them where they are. People with dementia are in their own reality. And so, who are we to tell them, no, that's not true? We meet them where they are, and we go with that. And then there are boarding care communities. A boarding care community is a smaller home-like setting, like a lot of the homes in the Mid-Peninsula, 3-bedroom, 2-bath type situation. They are communities that usually someone gets the license that I have, to own and operate, and they make modifications to the home, and they have typically 6 beds available in the home. So they're often shared rooms. Sometimes they can be private, but it's a much smaller setting. So imagine a home and with 6 seniors in it and maybe 1 to 2 caregivers. And the caregivers are there, they're cooking the meals, they're doing some activities depending on the person's level of engagement, and they're providing the care. Those communities are really good for people who are at risk for falling, and they have some mobility challenges because you get a really, really high staff to resident ratio. So you have somebody with their eyes on your loved one, which is really good for cognitive issues. And then also they're one of the more affordable options with shared rooms starting at $5,000. The price is usually an all-inclusive rate, which is really nice. Compared to an assisted living community, you have the price of your apartment, which includes the amenities and services, and that might be $5,000 or $6,000 for a studio in this area, and then your care is on top of that. And there's a couple of different ways that they determine what type of care you need. That can be a point system, and for everything that you need, you calculate a point, or it could be a level system, and there's pros and cons to that. But you have 2 costs that you are responsible for monthly, and that can add up. Whereas the boarding care, it's consistently that rate, and that's it. You can anticipate what that would be. Then skilled nursing. Skilled nursing is more of a medical model, whereas assisted living, boarding care, that's a social model. A skilled nursing is, think of it as a mini hospital. They have licensed nurses there around the clock. They have a physician that does rounds there. They do more advanced medical needs, whereas assisted living has limitations on the type of care that they can provide. Skilled nursing is for people who need some pretty intense care. And there's been some recent programs that have been developed because we have a limit of skilled nursings, and there were a lot of people in skilled nursing that didn't really need to be there. They didn't need the oversight of an RN 24/7. So there were some programs that are for Medi-Cal recipients to be able to participate in programs like the assisted living waiver. Skilled nursing, if you pay privately, I think it was mentioned, it's about $20 to $30 or $30,000 a month. It's really expensive. And if you don't need that type of care, there's assisted livings for that. If you can't afford those options, and if you have Medi-Cal, fantastic, because Medi-Cal has programs that will help with that. It's called the Assisted Living Waiver Program. You have to have Medi-Cal in place, and then you have to also apply for their Assisted Living Waiver Program. There are really, really long waiting lists, but there's also a couple of new programs that have shorter waiting lists. But if you need care, Medi-Cal will pay for you to be in a senior living community that they're contracted with, and pay for your care there, which is really nice. So there are options for people. But skilled nursing, majority of people go to skilled nursing maybe when they had a fall and they broke a hip, and they're done with the hospital, and then they go to the skilled nursing in the area, like Peninsula Post-Acute here, and they get some therapy, maybe see a nurse, and they're there maybe 3 weeks, and then they're discharged home or discharged to a community, or discharge home with a caregiver, those type of things. Majority of skilled nursings are focusing on short-term rehab, and they have a very, very limited bed in what's called long-term beds. They're extremely hard to find. They're pretty rare. But those are the types of senior living communities. What's required, I thought I was timing myself. I think I forgot to press start. So. Okay. There are different requirements to move into each type of setting. I recommend that people be proactive and start having this conversation. What does it look like for you or your loved one? What type of communities are in your area? Could you afford the communities in this area? Could you afford $9,000? Some people can't. Some people need to sell their home to pay for senior living. Some people have wonderful long-term care policies. I am definitely an advocate for that. Sometimes we have to look at it maybe a little bit further out in the East Bay, where you get a lot more bang for your buck. And there's a lot of variables. Some communities have pools, some communities have gyms and movie theaters. Sometimes there's cultural differences, and I have my clients ask, is there a population of this specific culture or that serves this food? And there certainly are. And so I help you navigate all of those options. My service is a free service, which is fantastic. You get to utilize my industry knowledge, my expertise to make this an easy process for you. And my goal is to take as much off your plate to make this easier for you. So I did, you have my flyers. I have some brochures in the back. I have these postcards that I'd like to encourage people to put on their fridge. And this is a hotline for locally. If you have any questions about anything senior living, senior care, I'm very well connected in this industry. I utilize home care, I utilize elder law attorneys, everything that you can think of. If you need help, please feel free to give me a call and we can have a conversation. You don't need to talk to me about placement. I just want to be a resource to people. Okay, thank you.